Thank you for this opportunity to speak with you this morning. I know that they made this as a training or workshop in a sense, but we're going to pretty much have a discussion around what marijuana advocacy is, as it's in its title. And I asked that as we start, I wanted to see what you all knew out in the communities, what you know about marijuana. So there's a quiz before you, and some of you have will be able to talk about some of these areas as we would like for you to answer them in its entirety, and then we will go into this discussion. Give you a couple of minutes to see, and I'm not sure if you need me as well. There is not necessary for me to maybe read them, but we'll be discussing the answers as it relates to our area across Detroit, Wayne, and hopefully you all, once we'll give you about 2 or 3 minutes, I guess, to complete all questions, and then the moderator will put up your responses. Don't forget to scroll down. It is 7 questions. It's not 3 before you. Thought I would say that so people would know that there are. The submit probably won't let you submit until you are complete with your answers.
Oh, okay, so I'll give it another 10 seconds and then we'll go ahead and end the poll. Okay.
As we go through the questions, I'm just going to give you on our end, why does it, why do we see that it is legal to sell marijuana? And you see a majority of you have given 70% of that as being true. 30% has stated that it's false. What is the legal age? 30% have it as 18, 0 for 25. 70% have said 21, and 0% for the 19. And then the third question, and I'm going to do responses for each for the first 3, and then we'll go and do the review for the next 3. We see that because marijuana is a natural plant, the smoke contains fewer carcinogens than cigarette smoke. 60% of you have said that is true, 40% said it's false. The fourth one, I'm sorry, I'm going to review, as I said, 3 first, so I'm going to share my screen. Just a second. I don't know if I can actually do that if I don't go through the questions first. Let's go through the questions first. I just realized if I take away this, it'll take away what your responses said. So we'll go through all, and then we'll go through all of them at the for the answers at the end here. So 4 says marijuana does not affect your driving ability. 10% of you said true, 90% of you said false. 5, marijuana is not addictive. 100% of you said it is false. Marijuana is not addictive. Marijuana edibles are a safer alternative to smoking because rather than inhaling smoke, the THC is consumed. 60% said true, 40% said false. Vaping marijuana is a safer alternative to smoking it. 100% of you said that was false. And I'm going to close the poll now and present to you the share my screen with you just a second as I slide this over. To give you our answers. Sorry, just a little bit. I'm on screen. Share my screen here. There we go. So the first one here as it relates to the quiz. Is everybody seeing that? No, because I have to hit share. I just can't click it, can I? So for those who answered in our, and I'm don't know you recall what the poll stated, but for Detroit, there are 47 facilities within our city and Wayne County limits that we are, that have licenses granted. There are, the legal age for you to purchase marijuana is 21. And this is our reason behind, the purpose behind letting you know that as well. The question on it being true or false, because marijuana is a natural plant, the smoke contains fewer carcinogens than a cigarette smoke. That is false. The marijuana plant contains more than 500 chemicals, and smoke from that marijuana contains many of those same toxins, irritants, and carcinogens as tobacco smoke. And also resources here you will be receiving as well through this presentation. True or false? Marijuana does not affect your driving ability. That is false. Marijuana can slow your reaction time and ability to make decisions. I believe you all have that 100% correct, I believe, if I recall the responses. There's also data sources here for you to see why that is false and more information. Is it true or false that marijuana is not addictive? False. 1 out of 10 marijuana users will become addictive. People who begin using younger than 18, that number even rises to 1 in 6. It gets marijuana, and of course we know the gateway to that as well. The marijuana edibles question, are they safer alternative to smoking? Because rather than inhaling smoke, the THC is consumed. That is true. While it is true, we understand that there are still risks. We do know people are using the edibles for medicinal purposes as well. It's not noted in here, but you may have experiences where you have had either family members like myself who have used them for health purposes, mostly with their cancer-related instances or ailments. And edibles take longer to digest and to feel the effects, making it more difficult to dose. The 7th question is, vaping marijuana is safer alternative to smoking it? That is false. It is false because do not currently recommend it from the CDC or the Federal Drug Administration. Do not currently recommend use of vape liquids. You all know that we've talked a lot about how they are interchanged as well. You'll hear more of that in the upcoming thorough presentation because they contain THC. These products have been found to have a strong correlation with an outbreak of these e-cigarettes, vaping associated lung injuries, many of which you all in our region specifically know of how our numbers are rising during this season of COVID. And as I go, I'm going to stop sharing for a second and go to our presentation for you today. And I want you to just think on some of the things that I've already talked about just in that icebreaker. And as I go through this presentation today, I would ask that you also, and if any questions you have from those responses or anything that I've stated that is going to help someone or any further information, we have many experts across our region to always be there to help as well. I wanted to also start off with what are what we are here today to address. And excuse me, I'm a little slow in getting my slides going to share with you just after this morning. So forgive me. I'm going to hit share screen again. And it's strange when you have these two screens and you're trying to adjust them here. All right, so let's go from the beginning to our slideshow here. And this is, of course, our purpose today. And I'm hitting from beginning, it's not showing here. So today's presentation, of course, is around marijuana use prevention, the advocacy in our community, what we are doing to advocate for preventing it. So many things that we have here, what we're purpose today, as we talked about that icebreaker, some of those questions that you've responded to, you may have better knowledge or already knew what's the best way to answer. In advocacy, in our mission, we address that as a part of our Detroit Wayne goals to advocate. And I'm always looking at what does that really mean, advocate? We're going to talk a little bit about that definition. What we know to gain a better understanding of these impacts on recreational marijuana, what it has on our communities. And I'm not going to talk a lot about the medical side of it, but more of what we are seeing recreationally. How to access our services, to become more aware of our community, implications, etc. There are and ways on how you can help us advocate. And there's some facts and some myths around marijuana as well. We've had our icebreaker. You've seen the answers. So we're going into what we know. And again, feel free to chat your questions and see if there's things that you may want to inquire on. So we know that marijuana is a Schedule I substance. It has both THC and all Schedule I substances are illegal for any use. They are defined as highly addictive, having currently accepted medical use and treatment in the United States. We talked earlier on that age. It allows a person 21 years of age or older to possess, use, or consume, internally possess, purchase, transport, or process 2.5 ounces or less of marijuana, except that not more than 15 grams of marijuana may be in the form of the concentrate. And we don't want us to delve too much about how it's used and it's a plan and all of those wonderful things that you hear in our community. But as a part of looking at what that advocacy side, these areas that you'll see below the defined or what recreational marijuana is in the sales in Michigan now, what people are able to do. These are areas where you'll find a lot of information on it. And it's constantly, I think, because when we passed this recreational law back in December of 2019, it just seemed like they flourished or they became, more and more present and around our communities where they were, even at concerts or events where it was, you would know that it was around you. But as a part of our advocacy, it's of course, our goal was to do public support for or recommend particular cause or policy. Advocacy, this is the definition where we do support for, argument for, call for, push for, press for, to defend, to try to have some type of endorsement of preventing. So that's our purpose here, advocacy. Some other things around, as recreational marijuana sales began, I don't know if you all remember, the line that wrapped around in Ann Arbor around the University of Michigan. Seeing heads nod a little bit there. That's one of the first places that people went and came from around probably the region or other places. I heard some people came from out of state to get in line. So that was one of the first sites that was opened. So just think on how it draws, how you draw people to that, and where those opportunities for those who may see people out and getting those lined up like that. That's where we should be hitting those boots on the ground. And before, you know, before COVID hit us and all of that, we used to be able to uh, engage with the people and have our information out in following, as you see at the top here, this big circle, which we follow in trying to do strategic work, our strategic work of going out, seeing where those issues and concerns are with the community. We are following the strategic planning or prevention framework, as we call it, or model. And we want to make sure that we still incorporate all of that within this work, in our advocacy work and our prevention work. So this is our way of addressing it or attacking it, as well as even hopefully combating it through our messages, through our media messages, through those social media messages. And so our goals, we're working toward implementing the community-based marijuana response model. That is our plan that we have been working toward this year through Detroit Wayne. This goal for this program was to operate based on this community assessment. What you see in front of you, as I said, in the model we're going to follow, and the data problem analysis, some of which you'll see in a couple of my slides coming up. This analysis indicated that marijuana use disorder prevalence is in our communities where marijuana establishments open retail businesses. And there are so many places now, as well as you will hear a little more on even what our tobacco efforts have been doing, as I said, with the e-cigarettes and the ends and the vaping. A lot of that has been laced or included in smoking in it with it as well. So our steps to our programming is planned, and I'm outlining this. You're not reading it in front of you, but these are what our plans are here with the Detroit Wayne efforts and working through our providers. The programs are supposed to take steps to address the access and availability. We realize that there is a lot of availability of marijuana to our youth. Our goal was to decrease the instances of marijuana impaired driving. You saw that in your questions. When communities legalize, or which we have done, recreational marijuana. The program will also implement using these models, such as our educating our vendors, our retailers. I talked about our PSAs, those public service announcements, our evidence-based models, ones you will see coming up as well. This resources and slides will be shared with this group as I go through looking at some of the things that our efforts that we advocate for that I've already started talking about, and this being one of our priority areas. We, in number 3 and 4 really kind of connect with one another to reduce access to tobacco. We know that's one area, but we also want to reduce illicit drug use, which is where your marijuana falls up under. So these are the areas that our prevention services and coalitions like you are listening through this group right now want to address and advocate to work with every sector, working with the schools, health, these different fairs that we've had. Now we are doing town halls. Everything is held virtually. We're still working within those emergency rooms. We're addressing prescription drug abuse, underage drinking, and preventing under 18 from alcohol, tobacco, and other drugs. So it's for all of these areas that we address. We were looking at what's going across our Michigan area and the Detroit Wayne data. Specifically, there is, while these rates of almost every other drug seems to be showing a decrease, as you'll see in what we have here in Wayne County for alcohol, tobacco, marijuana, prescription drugs. These are what our past 30-day use, what our data showed us in the last one that I was able to to actually be able to share with you all is the 2018. Even though we know we are now in 2020 year was in 2019-20, that year where MiFi was not a year in 19, but it was in 20. And so there was some changes that we were not able to get for data. But I wanted to talk a little more on what we were looking to do as far as with some of our efforts and our evidence-based models. And that's coming up in just a few moments. While our rates, as I stated, seem to be decreasing, but marijuana use seems to be going up. And a new marijuana industry teamed up with these, of course, big pharma, big alcohol, big tobacco executives, is facilitating and encouraging this trend, presenting teens with new and appealing ways to ingest highly potent marijuana. According to the University of Michigan, where we made it recreational, one of the first places, there was youth between, in that fiscal year or year of 27-18, the percentage of 8th grade and 10th graders who reported vaping marijuana increased 63%. Over that same time frame, the percent of 12th graders who report vaping marijuana had increased by 53%. And although it seems like each week we've been hearing a lot more and more about marijuana and what its regulatory and how it's getting its availability and access. We were in a tobacco e-cigarette presentation yesterday, and one of the statements that stuck out with me was this one. We focusing on tobacco, but we're losing the battle on marijuana and its accessibility to youth. This effect is devastating on the growing brain. And that is really what, why we're advocating more and more, because of the detrimental effects that it's having on not just the youth brain, but all, that it does have its breakdown. I've also provided here, and reason things are highlighted, so once you receive the slide, there will be ways for you to click on these and see what items are coming. So we just were recently informed, I think within the past month, that there is marijuana infused beverages. These are available for sale at licensed marijuana stores, and they, at the time in January, I believe it was, yes, the 4th of January, they were approved by the state licensing agency. And that was the link from, that's the link from the site for you to see the details on the marijuana infused beverages. And they are mostly alcohol related beverages, not your non-alcoholic beverages. So you're having a double, you're getting hit in different ways with this marijuana and alcohol mix. So of course, part of our goal here, basically, as we're talking about our services and what our plan is to do, and I should probably have placed this slide after the ones is talking about what our services are doing and who's out there. But our services for anyone who needs to get help for substance use disorder, particularly for our prevention efforts, what we are discussing today. If you know of someone who needs help, there is always a provider available to address and help them to help them sustain from it, as well as to help as it's indicated when they start to use. So we have those 3 areas of the help that is out, as well as how you can contact to get those services. Our program's goal is to strengthen these protective factors around our communities by addressing what is most at risk with these accurate information on cannabis. As we know that is this other name, of course, we've got THC, cannabis, we've got marijuana, the different names of them, to articulate this potential consequences of misuse and abuse and offer activities unrelated to using. And here is our list of people that we want you to check out in our community. Also noted, one of the things that I pulled from testimony or one that I saw from our statewide, I should say, our national efforts of what has happened when it becomes contagious um, to the communities. There are so many stories out around people with marijuana related issues, and some things are leading to deaths. We're hoping that our goal is to prevent and continue to advocate for that. Um, Here are some of the services that I spoke on a little bit earlier that we have seen through our various prevention providers. These are some of the programs that they use that you may even be familiar with that are a part of our intervention efforts to address, along with their uh, marijuana educational information, as I mentioned, evidence-based models and curriculums, and also work with these direct and community-based programming. So you'll see here, I just posted a couple of ones that I got from our, each year we are part of the National Prevention Week, and on, I believe, the third day, it addresses the marijuana, the illicit drugs, and these are, excuse me, preventing illicit drug use and youth marijuana use is one of those, uh, day 3 in that week. And there were a lot of different promotional items, as I mentioned, PSAs. There was a YouTube that was done by by a prevention provider, National Council on Alcohol and Drug Dependence. Um, there was also through our different programs of what I've highlighted that they address it as boots on the ground. I know one's particularly, even with one of our programs, Spectrum, they're out doing barbershops and trainings right now, and they talk about those, every topic and what dangers of marijuana is, and as it states here, gateway drug. Um, Part of what those tobacco discussions are lead to this as well. And knowing it is not just knowing that it is natural, but it is also poisonous, as we can see that it's been doing to our communities. Um, the biggest portion of what we've been advocating and hearing about through our communities, hopefully you all have been a part of. If not, the Mobilizing Michigan Task Force has really been doing a lot of information and sharing with our communities. They're also located on the social media platforms, so you can see some of the information that has been shared across our state on the efforts, the call to action that's going on. There's been, as I said, a lot of communication around and a lot of efforts taken to hopefully get some prevention and get slow down on um, closing, I should say, or not having as much access and availability to our communities. There is, I do recall one instance, and I'm sure you all some have heard, one through the Youth Connection and the Love Detroit Prevention Coalition had an opportunity to meet with City Council and getting one of those facilities closed a couple of years back, and maybe now, or may have been about a year ago. Just knowing that the efforts are continuous and the heart of what our providers and our programs are out doing, even through this virtual arena as well. And my last couple of slides are just sharing more of what our resources and some of the links that we've even received recently, because I know our goals are to talk with parents mostly and persons that are a lot of times now, because our children are home and home from and are are surrounded by the the drug, in a sense that they see alcohol, they're seeing the tobacco right as secondhand, or they're experiencing the marijuana around them. We want to make sure that we educate our communities, our parents, the youth around trying to be safe. So they're recently came out with this Talk They Hear You has different levels. As I mentioned, there is ones that talk about alcohol, tobacco. There are different levels of ones that are addressing to keep our kids safe. So this is the link for that. Uh, the projects I mentioned earlier on the Mobilizing Michigan, the link is shared here. The study that talked about the teen's brain, how it's changed during, after use of marijuana just once or twice. Um, I thought of during the session to click on some of these, but I don't want to uh, take away from too much of the time during this session to show you, but they're accessible for you to go through and read. There's so many multiple resources out that are addressing um, preventing teens marijuana use. There are so many fact sheets that we have available that can be shared with you. I mentioned early on, our Prevention Network site has pages of resources around cannabis and the prevention of this marijuana use and how to go about advocating for preventing, what you need to write or how you need to continue to uh, combat it within your communities. The next generation, as you'll see here, we are the next generation, and our children are coming to see how they uh, we need to discuss it more, hear their voice, not just the voice of the adult, but how they feel about what it is doing. As you see toxins that come from it, how many much more toxins that were related earlier in this marijuana than in just tobacco. And then here are a few of the additional resources that talk about, and I'm meant to, I placed that it must have been really important for me to share it again on this teen's brains, because that is what we keep hearing. What is their effect on it? Some facts that I have always also looked into, hearing about what faith, what is the, behind all of this, why is there so much support, how we can to prevent the advocacy of, prevent the availability of it and advocate. But there are some religions that disapprove of illegal drugs and alcohol, but they give an exception to marijuana. And so I'm always looking for, well, why would that be? And where does that fall in some of our cultural um, communities, various diverse cultures? There's even different stories around our nation that talk about what some of those consequences happen as a result of smoking. As young as 19-year-old here having trouble seeing because they have ingested this marijuana, and unfortunately ramming into the police car. And also with its legalization spread across this country, as we've noted, we started off trying to make sure that our communities were educated on um, why did we not want to have it come to Michigan? Because there was so many things we saw in the data in Colorado. That was to set the presses, set precedents, excuse me, set us to make us not want to uh, have it in our communities, in our state. But as you can see where we are now, um, there are different, available slides of information. If you, go to the Mobilizing Michigan site, these are just a few of the ones. And some who may or may not know that there is even a special date and time that was set. This 420, that was the date, or that is still the date that is recognized as Marijuana Day, or the day for people to go out in the community and smoke. But as you'll see, even in with this time of COVID, there are even higher risk of it being confirmed. So multiple resources around what it has, how it affects your heart, how it affects your health, how it's affecting the brain. So many ways of it being detrimental to you. I posted this slide in here to always include where our services, where our prevention providers are always around every community across these 43 cities. And it's pretty big and large to show you that across Detroit, Wayne County, what we touch. Even looking even across the water in a sense of things that we know, that we have people to go, we're going back and forth because they worked here across the water. We are close and border areas that are even trafficking in a sense for the drug availability or happens. So you'll see why we are trying to cover it across our region, and we be in region 7, but also across Michigan. And so I wanted to just show you where our services are shown as far as in our 43 cities. And this is the slide of who of information. And before I go into saying this portion here, I did want to highlight one other statement. And I wasn't really looking to see how my time was going at this point, but see, there was a quarter to 11, and I knew he asked me to go about 20 to 30 minutes, which I thought was a lot. Just highlighting some of those things a little more on what we are disseminating through our public service areas. I did show you uh, that our various providers of things that they were doing, and our ultimate goal of educating the community, specifically on legislation, on the law, on requiring what signage we had on that second slide. I'm not sure, I think I may have gone through it quickly because of the um, questions being there, but it's been included as a part of our tobacco efforts. And we'll be doing mobilizing across our communities information with decals. And we'll have the posters that talk about what is the legal age, because it's moving to 21 for tobacco. For the state of Michigan, it is still 18. We are awaiting what the signage that will be posted in our retail locations to talk about the sale of marijuana products to youth under 21. And then 2000 is the year that the retailers are to look for people's licenses and their age to sell. Um, Other areas that we are looking and grateful to see that our communities are partnering with uh, to educate our doctors and our physicians that are so sometimes prescribe things that are um, counteract with, or that are just to educate them on its use. Because I've even see even in our television shows sometimes they talk about what the doctors feel it is safe, how, so there are still things that are need to happen across our education through our doctors and our physicians. And our ultimate goals to decrease this access and also have decrease of harm reduction, and to ultimately help this impact that is happening on our mental and our physical health. Our goal is to reduce. This is part of those health disparities that we even address across Wayne County as well. And so that is overall what I wanted to share with you. There's so much more, as course, as our programs are doing, but I encourage you to contact or look at some of those that I've shared earlier regarding what our communities are doing and partner with them to get more education on as well. And I will, at this point, as you'll see, there's 3 of us in those initiatives, substance use disorder now for the staff. And they're myself, Karra Thomas. Judy Davis is our interim director. She's also the treatment services administrator and recipient rights consultant. And our Matthew Yasko is the state opioid response coordinator. And here's our contact information as well. We do have the opening for our SUD director available now, and it has been posted for those who are interested. And that is opportunity for you to put your questions and provide any additional support as I ask, because I know I have some providers here that may be willing to share what they may be doing as well. I see there may be some items in the chat. So if you would like, I will stop sharing and let me know if you, our moderator will be, if there was any questions or anything that I may have even missed, if you will let me know.
Thank you so much, Karra.
One moment, Marcel, I need to inform everyone our next meeting will be on Thursday, March the 18th at 6:00 p.m. We alternate every other month. We have a meeting at 10, and then the following month it'll be at 6. And we want to remind everyone to complete the feedback form and email it to the Center for Urban Youth and Family Development, CUYFD, at cufydcoalition.org. And then any questions for Karra? No? Well, we're certainly better informed. Yeah, me too. Certainly better informed than we were when we started. Thank you so much, Karra.
You're welcome. I hope that there was something that was shared that you didn't know, and there was something that you will be able to receive from and to share with your communities. Thank you.
I went ahead and put the link to the chat. If everybody could go ahead and fill that out before you check out, that would be great. Thank you.
If there are no questions for Karra, anyone else have any other questions, comments, feedback? I'd love to hear it. If not, the chair will entertain a motion to adjourn the meeting. Hello, are you all out there?
Second, Marcel Arbuckle Jr.
It has been moved and second that this meeting be adjourned. So moved. Thank you. Bye, everybody.